I feel that as a physician, you're always a leader in healthcare. I never knew that I was going to continue into the administrative portion of healthcare. But as I worked my way through UAG and residency, it really came as a calling. Well, it made me who I am. So UAG, I started here. I was very happy. They built my foundation and the building blocks that I needed to succeed in healthcare in the United States. It's a great question. When I started seeing patients, loved it, loved patient care, but I thought that going into leadership and administration really was able to expand what I'm trying to do locally with a bigger market without even putting a stethoscope on those patients. So changing policies, changing processes, evidence-based medicine really got me into this leadership pathway and administrative way to get to where I am. So I love seeing patients. It's a calling, as we all know, and having that human touch was vital for my daily living. So I really needed to still connect what I do at the clinic level and with my patients and bring that into my administrative role and the chief medical officer position. So it's always making sure that you have a pulse to the ground, and having that connection with the patient allows you to make better decisions when you're in the leadership role. I've seen thousands of people, different cultures, different ages, and what it's really taught me is always stay humble. Always make sure that you listen, because the answer to their problems is right there. You just have to make sure you listen to them and spend that time in order to make the right decision. So it's a very humbling experience, meeting different cultures, and it's really shaped also who I am. Without it, I probably couldn't be where I'm at. So being bilingual, specifically with Spanish, knowing Spanish and English, has, at least in my community, was a must. And without it, I would have not been able to practice or even, get where I currently am. You deal with not only a lot of languages and people, but the Latin culture really is very heavy in Florida, and it really allowed me to be able to feel part of what they're doing in their communities and really understand where they want to get to. It's always knowing, I feel that it's always being with the patient. Certain times, I still see patients, and just having that connection with them and patient care not only just brings a lot of gratitude and satisfaction to my everyday being, but it also allows me to connect with the patients that I've probably been seeing for over a decade. That I know their family, I know their kids, and it's really special. It's a special occasion every time I go and see patients at the clinic. For me, it's going back to day number 1 when I first started seeing patients. Simple, several words: accountability, responsibility, humility. Connecting those together, making sure that the same with your colleagues. This is a team, and making sure that everybody's on the same page, taking those challenges that the patients are bringing to us and making sure that we are able to help them. And not only with their clinical problems, but also with their social issues, mental issues, behavioral issues. We got to make sure that we close that loop. To answer that question, it's pretty, I could go on and on, but I think it's just making sure that we're responsible towards our community and our patients, and that we take accountability to what we're trying to do in changing the shape of medicine in where we practice. Being involved. We're stronger together, making sure that you reach out to your alumni association, like the UAG alumni chapters that are in the United States. Making sure that you reach out to your community resources, and making sure that you reach out to your fellow colleagues. Strength is in numbers, and making sure that there's a lot of advocacy that needs to be done, not only at the community level, but at the state and national level, and we all have to be involved to make the change. Work hard. UHG, like I said before, really builds a great foundation to make you successful in the United States. But you gotta put in that effort. You gotta work hard. You're not gonna be spoon-fed. So just working hard and making sure that you make the right decisions, hopefully with your families, your friends, your colleagues, going back to UHG, mentorship. The Alumni Association is there to also mentor you, and use those resources, and you will be successful. Make sure you identify where you want to go, what do you want to be, and where do you want to get to, and we're all here to help you. Longevity. This is, it's a marathon, it's not a race. So make sure that you pace yourself. You always have to take care of yourself, your family, and your friends before you take care of the patients, because without you, and if you're sick, you won't be able to take care of the patient. So longevity for me is key to be successful and to continue a great career in medicine, but you have to pace yourself, and you have to make sure that you take that time and you decrease that burnout, and make sure that you have that work-life balance throughout your career. Made me who I am. So I started off here in UAG in 1999, and it really allowed me to not only give me the knowledge, but allowed me to go into my rotations in the United States. It gave me that foundation to help me succeed succeed. And it really put me in a situation where I was able to get my residency of choice. I stayed in Florida. It really built up with the help of some of my colleagues from UHG too. It really helped me build myself up to where I'm at today. There's just a lot of more work to be done. Again, working as a team, and we got a lot of advocacy to do at the state level and the national level, but we got to do this together, and UHG is an organization that allowed us to where we are, especially myself. I love it. It was long overdue coming back to Guadalajara, and again, it goes back to pacing yourself with your career and making sure that life doesn't get in front of you. I took this opportunity, and it's an honor to be here, to come back to Guadalajara and see some of the people that I saw 20 years ago, 20 plus years ago, see the building, the campus that really helped me get through many hard days and nights too. But it's a pleasure, it's an honor. We have to do it again. Greatest memories here in Guadalajara, of course, is relationships that I built amongst my colleagues that I still talk to today. And of course, we can't leave out food and the culture that is excellent here, and the music. So there's many things that I could say that I love about Guadalajara, and I got to come back and explore them 20 years later, again and again. Funny stories, we have many during, our colleagues, with my student friends. We've explored the community, explored the culture here, and some funny stories are when you go to some restaurants and you eat something that might not go well, and then you bring that into your study sessions with your colleagues, and then the test. Now you laugh about it, but back then, when that person is not feeling too well and going to a restroom, and you kind of laugh about it and say, I told you so. But there's been many of those episodes throughout our career here in Guadalajara.